Hello everyone, I am Amir Ali and I am here to present the research study design and settings. So the agenda for today's presentation is we will discuss about the quantitative research methods, the qualitative research method, quantitative research design, qualitative research design and study settings. So what is research? Research is a process of steps which used to collect and analyze the information to increase our understanding of a topic or an issue. So at a general level, it consists of three steps. It poses a question, then we need to collect the data to answer our question, and then present an answer to the question in a systematic way. This is the overview of our research process. It includes both the qualitative and the quantitative research. As you can see, the research process starts with the research problem. Then it goes to the literature review. After literature review, the research question is formulated, which is guided by the literature review. And again, the research question answer the literature review. So it is divided into two parts, quantitative research and a qualitative research. These are both the research designs. So these the research design are mainly divided into two, quantitative and a qualitative design. And then we have a third method, which is the mixed method. The quantitative design include experimental designs, correlational design, and survey. The qualitative designs include grounded theory, ethnography, and the narrative research. The combined design include mixed method and the action research. For all of these research, we need sampling, instrument protocols, data analysis, and interpretation. After that, we have the process of discussion, conclusion, limitation, and the future research. This is the whole flow of the research process. So what is quantitative research methods? Quantitative research method is an approach for testing objective theory by examining the relationship among the variables. In quantitative research, we have a variable that are countable, for example, that are quantifiable, like age, weight, or anything which you can count in numbers or in specific units. These variables in turn can be measured typically on instruments so that the number data can be analyzed using statistical procedure. The final written report has a set of structure consisting of introduction, literature and theory, methods, results, and discussions. The researcher in this form of inquiry have assumptions about the testing theory deductively, building in protection against bias, controlling of alternate explanation, and being able to generalize and replicate the finding. Like if you have done a quantitative research, if another person wants to do the same research, then the results can be replicated. They will get the same results. The major characteristics of quantitative research are describing a research problem through description of trends or need for an explanation of the relationship among variables, providing major role for the literature through suggesting the research question to be asked and justifying the research problem, and creating need for the direction, that is purpose statement and research question or a hypothesis of the study. It collects the numeric data from large number of people using instrument with preset questions and responses. It analyzes the trends, comparing groups, relating variables using statistical analysis, and interpreting results by comparing with the prior predictions and past research. Example of the quantitative research. The title, Risk Factor for Developing Type 2 Diabetes, Case Control Study. The type of study here is the case control study. Another example is the association between physical activity and cardiovascular health, a prospective cohort study. In this study, we are looking for the association. The word association describes that it is a quantitative research. Qualitative research methods. Qualitative research is an approach for exploring and understanding the meaning individuals or group ascribe to a social or a human problem. The process of research involves emerging question and procedure, typically collected in the participant setting, data analysis, inductively building from particulars to the journal themes. The researcher making interpretation of the meaning of the data. We don't have numbers in the qualitative research method. We have the words or the descriptions which the researcher have collected as a sample. The final written report has a flexible structure. The researcher in this form of inquiry support a way of looking at the research that honors an inductive style, a focus on individual meaning, and the importance of rendering the complexity. The example of qualitative research method, like the patient's experience and perception of type 2 diabetes, the a qualitative study. Patient's experience and perception, it's showing that it is a qualitative research. The characteristics of the qualitative research include exploring a problem and developing a detailed understanding of central phenomena, stating the purpose and research question in journal and broad way, so as to collect the participants' experience. It collects the data based on words from small numbers of individuals so that participant views are obtained. Analyzing the data for description and themes using text analysis and interpreting larger meaning of the findings. Writing report is flexible in qualitative research, emerging structure and evaluative criteria, and including the researcher's subjective reflexivity and bias. This is again the example of types of qualitative and quantitative research. In quantitative research, we have intervention research and non-intervention research. It explains whether an intervention influences an outcome of one group as opposed to another group, which again has two types, associating or relating the variables in predictable pattern for one group of individual or describing the trends of population for a people. The qualitative research design include exploring the common experiences of the individuals to develop a theory, exploring the shared culture of the people, or exploring the stories to describe the lives of people, which is the narrative research. Then we have a mixed method which combines quantitative and qualitative research to best understand and explain a research problem. Using quantitative and qualitative data for individual to study education problem that they face in the setting, which is an example of the action research. So what is the main difference between the type of clinical research study? The main difference in researcher assign participant to get an intervention such as the drug, behavior, or a medical device. So as you can see the difference between the clinical trial and an observation study. In clinical trial, researchers do assign participant to one or more interventions. Sometimes researchers randomly assign participant to the intervention, and in observation studies, researchers do not assign participant to an intervention. If there is an intervention, participants were already using it as a part of their regular healthcare or a daily life. What is the research design? A research design is a plan, structure, and strategy of investigation so convinced as to obtain the answers to research question or problem. It includes an outline of what the investigator will do from writing the hypothesis and their operational implication to the final analysis of the data. These are specific procedure involved in the research process, include data collection, data analysis, and report writing. So what is the difference between quantitative and a qualitative research? In quantitative research, data collection methods use interview sessions, discussions with the focus group, and case studies, and ethnography. Data collection in quantitative method includes surveys, experiment, observation, and the content analysis. Observation studies include descriptive studies, case report, case series, correlational studies. As you can see, the strength of evidence decreases from case report. The strength of evidence increases from case report, case series to the clinical trial, and the highest evidence is for the studies are the systematic reviews. The case report includes the single case series have a collection of similar cases. Correlational study design is based on the population study using the secondary data. Cross-sectional or descriptive studies include single sample from larger population in which there is no comparison. Analytical study design, like cross-sectional studies, use a single sample from large population and compare it with the two groups. Case control studies, we have two groups. One is the case and other is the control group. And the disease is compared between the two groups for the risk factor and the associations. The cohort, in we compare outcomes between the groups exposed and non-exposed to a risk factor of a disease. The example of intervention studies the clinical trials. The investigator allowed the subjects to different groups of intervention versus non-intervention. So the quantitative research design. The type of quantitative research design include experimental designs, which is also called as the intervention studies or group comparison studies, that are procedure in the quantitative research in which the investigator determines whether an activity or material make a difference in a result for participant. We assess this by giving one group a one set of activity called an intervention and withholding the set from the another group. Example, randomized control trial. A study investigating the effectiveness of a new drug for reducing blood pressure. Participants are randomly assigned to receive either the new drug or a placebo, and their blood pressure levels are monitored over time. So the next study is the descriptive research designs. Descriptive research design aim to explore and understand the current state of things like people, places, health conditions, or any events. Here the researcher goal is to gather general observation without exploring the reason behind them. Importantly, descriptive research does not try to prove or disprove the hypothesis. It is mainly about creating a research hypothesis. Descriptive studies can be of several types, like case reports, case series, cross-sectional studies, and ecological studies. Correlational designs. Correlational designs are procedures in quantitative research in which investigators measure the degree of association or relation between two or more variables using the statistical procedure of correlational analysis. This degree of association expressed as numbers indicate whether the two variables are related or whether one can predict another. To accomplish this, you study a single group of individuals rather than two or more groups as an experiment. The example of correlational study design is a study looking into the relationship between alcohol consumption and unemployment. So we are comparing the two group alcohol consumption and the unemployment. Survey design. Survey designs are procedure in quantitative research in which you administer a survey or a questionnaire to a small group of people called as sample to identify the trends in attitudes, opinion, behavior, or characteristics of large group of people called as population. This is the summary of for the types of clinical research. We have experimental studies and observational studies. In experimental studies, we have non-controlled trials, non-randomized control trial, and a randomized control trial. In observation studies, we have descriptive studies and analytical studies. In descriptive studies, we have case study, case series, cross-sectional study, and ecological study. In analytical studies, we have cross-sectional studies, case control study, and cohort study. Qualitative research design. The type of qualitative research design include the grounded theory design, in which The grounded theory design are a systematic qualitative procedure that researchers use to or generate a general explanation called as the grounded theory that explain a process, action, or interaction among people. The process of for developing this theory include primarily collecting the interview data, developing relating categories or themes for information, and composing a figure or visual mode that portrays the general explanation. In this way, the explanation is grounded in the data from participants. From this explanation, you can construct predictive statement about the experiences of the individual. The other qualitative study design is the ethnographic design. Ethnographic design are qualitative procedures for describing, analyzing, and interpreting a cultural group shared pattern of behavior, beliefs, and languages that develop over time. In ethnography, the researcher provides a detailed picture of the culture sharing group, drawing on various sources of information. A ethnographer describes the group within its setting, explore themes or issues that develop over the time within a group and interact with them for to, to portray their details. Narrative research design. This is another type of qualitative study design in which the researcher describes the lives of individuals, collect and tell stories about these individual lives, and write narrations about that. Mixed method study design. It is the combination of qualitative study design and quantitative study design. Mixed method design are procedure for collecting, analyzing, and mixing both quantitative and qualitative data. In this process, you need to decide to emphasize whether you will give to each form of data priority. Which form of the data you will collect first, either quantitative or qualitative. These are the examples of the study design, that types, and relevant research question. For the cross-sectional study, the research question can be what is the prevalence of hypertension among adults aged 30 to 40 in the urban areas? For the cohort study, the research question can be how does smoking affect the incidence of lung cancer over the period in a over 20-year period in a specific population. For the case control studies, the research question can be what are the risk factors associated with developing type 2 diabetes among adults. For randomized control trial, the relevant research question can be how does a new drug reduce the incidence of heart attacks compared to placebo in high-risk patients. For the survey design, the research question can be what are the common dietary habits of teenagers in Islamabad. Now, these are the types of the qualitative research design and their relevant research questions. For the grounded theory, how do individuals cope with the chronic pain in their daily lives? The example of phenomenology include what are the lived experience of patients undergoing chemotherapy for breast cancer. The example for case study design include what factors contributed to the successful implementation of public health intervention in a community. The example of mixed method study design include how effective is the community-based weight loss program and what are the participant experiences. As you can see that we are taking the both part. In quantitative part, we are investigating the effectiveness of the program, and as a qualitative part, we are investigating the participants' experience. So the major difference between quantitative and qualitative study design. The purpose for the qualitative will answer the question why. In quantitative, the question include how much or how many. The type of data used in qualitative is the observation, symbols, words. In quantitative, we have numbers and statistical results. The approach used for the qualitative data include observe and interpret, and in quantitative, we will measure and test. In analysis of the qualitative study, grouping of the common data is used and non-statistical analysis methods are utilized. In quantitative, the statistical analysis methods are used. Now, our next topic is about the study settings. The study setting refers to the physical, social, and cultural environment where the research is conducted. The aspect is crucial for evaluating applicability, generalizability of the study findings, as well as their validity and reliability. Variations in the organization, experiences, and resources of healthcare institution can significantly influence the condition under the investigation. What is target population? The population or group of individuals that researcher is interested in researching and analyzing to make a difference or understanding the phenomena. As you can see in this diagram, this is the whole target population. For example, children of age 14 to 25. We will take a sample from this population. What is eligibility criteria? Eligibility criteria are the factors that used to determine whether a person is eligible to take part in the study or is not eligible to take part in your study. The inclusion criteria include the key factors for the target population that investigator will use to answer the research question. The typical inclusion criteria includes the demographics, clinical and geographical characteristics. The exclusion criteria. Participants who meet the inclusion criteria but present with the additional characteristics that could interfere with the success of the study or increase the risk of an unfavorable outcome. Common exclusion criteria include loss to follow up, schedule, appointment to collect, provide inaccurate data, comorbidities that could lead to the bias for the study or the risk of adverse event. Example, the study setting. You can write the name of the institute or an organization in which you will collect the data. Target population. The target population include college student age 18 to 25 who are current smoker and enrolled in the study. This is an example. You can write the target population according to your study. The eligibility criteria. For example, a student age 18 to 25 who have smoked at least one cigarette in the past 30 days and are currently enrolled in the university. The exclusion criteria can be student with diagnosed mental health condition that could interfere with the participation. Those currently enrolled in another smoking cessation program and a student with severe respiratory condition that requires medical intervention. This can be used as an example and you can modify it according to your study. Thank you.